101. We're going to get started. So, good morning, well, afternoon now, and welcome to everyone for today's August Lunch and Learn. Again, please forgive my voice. I'm battling COVID at the moment. Today's speaker is Elizabethtown College student Samantha Phillips. She is the 2022 WellSpan sponsored summer internship winner and has been working here at the museum for the past month or so. Her interest is to one day work in women's health in Lancaster County as a physician's assistant. As part of her summer internship, Samantha has been working on research regarding women's health in the Plain community. Today, she will be discussing her work, her time here at the museum, and some of her research. As always, please silence your audio, and any questions you have, please put them in the chat and we will discuss them at the end of the presentation. So I will pass it over to Samantha, and let her begin.
Hi. Thank you all for joining us. So as Kim mentioned, I am going to be talking about my research with women's health in the Plain community. I just want to start. Okay, I just want to start with a quick disclaimer that this is a project that is still in the works and that is covering a couple sensitive topics. I've done my best to just report what I have found, and none of my statements. Hello?
Sorry about that. That was
Okay.
my fault.
No, you're good. Where did it cut off?
You're still your disclaimer. You can carry on, yeah.
Okay. So I just wanted to take the time to mention that everything I'm reporting is just what I have found, and it does not reflect my own opinions. I'll probably mention this a couple more times. Okay, there we go. So I just want to do a quick overview of a typical Amish pregnancy. We're going to see home births are very common, and pregnant women will continue to work up to giving birth. This is sometimes even a few weeks past their due date, which isn't super common in the English community, which is due to health concerns for mom and baby. After about 40 weeks, the placenta will start to deteriorate, which will lead to lower blood circulation for baby and also problems for mom. Within the Amish community, they do not do any kind of intervention with this, and typically they will just continue to run the course until nature says it's time. And very little medical treatment or intervention will be sought or accepted. This includes any kind of in utero treatments, as well as after birth for treatments for baby. And they will typically be relying on midwives for care as opposed to in-hospital births. Multiple pregnancies are very common, with the average Amish woman having 7 pregnancies in her lifetime. So I want to speak about the Amish midwife for a little bit. Amish women will rely on midwives for assistance for the whole pregnancy, with childbirth, and after giving birth. They will typically develop a very strong relationship with their midwife, often going to the same midwife pregnancy after pregnancy. This was very common in the English community until a shift from home births to hospital births happened in the 1920s. One controversy with Amish midwives that I have found in my research is that these midwives do not have formal medical training. They are trained on the job through apprenticeships and are referred to as lay midwives. This has caused some legal troubles, specifically in Pennsylvania, and a 2008 case with the state court did rule that lay midwives are not prohibited. This is not necessarily encouraging lay midwife practicing, but just allowing it and accepting that it is what is best for the Amish women. And this acceptance of lay midwives is very important for Amish English community partnerships, as to not deter women from seeking English treatments and English medical providers. by allowing them to do what they prefer and giving them the chance to seek help when they want. So I just wanted to talk about, as I said, with Amish women seeking help within the English medical community. So first-time moms will often seek medical care early in the pregnancy just simply to confirm pregnancy, but they do not often go in for additional checkups. They will typically work with their midwife to discuss how they'll be giving birth, but this was usually just going to be for first-time moms. As pregnancies will progress, you'll see less and less medical care and just more and more just letting it happen on its own. So I do know that we have a lot of doctors here, and I just wanted to say that I am not speaking to you as someone who's trying to tell you what to do. It's just what I've learned, what I've seen throughout my research, that there are a lot of English medical providers who will try to displace the midwife. They will try to take over care, and they will try to contradict what the midwife is saying and try to encourage the Amish women to seek treatment from English providers. This isn't always the best course of treatment, just because it will discourage the plain women from returning for subsequent pregnancies, and it might discourage not necessarily just the one specific patient, but all of the community from coming to seek medical attention from English providers in the future. So I've learned that English providers who make an effort to collaborate with the midwives and are able to contribute to care, but when needed, but are not trying to oppress their opinions on the midwife and the patient, are seen as more favorable and are who the women will want to choose to go to for their following pregnancies. I'm going to speak about this a little bit more later, but there's also an issue with transportation and financial barriers that will prevent these women from seeking medicine and seeking care from English providers. So a little bit on finances. Most Amish families do not have health insurance. One thing I did learn with an interview with a woman who left the church when she was younger is that the community will have something called Amish Aid, where it's just in-community insurance. It's where members of the community will save money to put aside for health bills and any other kind of needs for anybody in the community. So everybody is putting in money, and anybody who needs it can have it, what they need, zero questions asked, is what that's for. I thought this was really very cool thing that I was able to find. And it is just an interesting kind of something that is important to think about when talking about Amish women coming to seek healthcare from English providers. And they're also seeing that in an effort just to save money in general, pregnant women will not see a doctor regularly, and they will only go if there's a significant issue. So they will, as I said earlier, medical care will be focused on the first pregnancy early on. And if everything goes well within the first pregnancy, we'll see that they will not continue to go for subsequent pregnancies unless they have something that is concerning. This is kind of tying into where I was saying is we want to encourage the women to want to come to English providers if they see it fit. And we just want to try to encourage, does not discourage them from coming in. So one of the main things that I've been finding when I was doing my research is that there is a large number of recessive genetic disorders within Amish populations. This is going to be due to, say, like one person many generations ago would have some sort of disorder. Then they have children, some of which are affected, some of them are going to be carriers, and then that just continues to move down generations, and then eventually you'll be seeing like generations down, those offsprings will those children will have children together, and you'll have the same genetic disorder being carried down through families. A lot of these disorders are not seen outside of the plain community. There are even some that are very specialized to location. There are a couple disorders that are only occurring in Lancaster County Amish populations, which is really interesting to know. But it does limit research on these disorders just due to how specialized and how specific they are. That being said, there are newly implemented screening processes for these disorders that can be done prior to conception as well as after conception. I did in my interviews learn that a lot of former members of the planned community are not aware of this yet, that there's still a lot to be done in terms of marketing and just making it more commonly known that this is something that is available, something that is something to be considered. This is specifically going to be aimed at the English couples with family history of a plain background, as well as current members of the Amish community. So I wanted to talk about one specific testing that I found that is offered by the Clinic for Special Children. This is an expanded carrier test that is specialized for plain communities within a couple of states, including Pennsylvania, Ohio, Delaware, Indiana, and Wisconsin. This test will be for the 1,300 genetic variants. And so what these tests are is just to kind of make couples aware of their chances of having a baby with a specific kind of genetic disorder, the odds of having their odds of having a healthy child versus one with one of these disorders, and as well as diagnosing children in utero, so that if so fit, they can start treating sooner, so that once baby is born, they have a little bit better chance. This, as I said, leads to better outcomes, but also helps prepare parents, and so that they know what they're bringing into the world. They already have a strong understanding of what their child might have, as well as subsequent children. So I just wanted to, this is kind of another point where this is just sort of what I've found. That Amish couples who have children with these disorders, who are found to be carriers for these disorders, they are not deterred from having more children. And English populations will have additional screening and selective fertilization and a couple other newer treatments to try to prevent having children with these disorders. In the Amish community, they are not interested in this kind of screening, as well as they are going to continue to have children, regardless of what the chances of having kids with any kind of disorders. So these affected children are referred to as a special child, and they are accepted as God's will. There is very little that will be done for further treatment, regardless of what effects on their lives, and some of them will continue to work as well. So interventions for affected children will not be allowed. So I just wanted to talk about their reproductive beliefs. Again, this is just kind of what I've found. And it's very, from what I have found, is very black and white across the board. Birth control is just not allowed by the church, including the women who I've spoke to who have left the church. They still hold these beliefs that there are just no birth control is going to be allowed. And this also is including termination of pregnancy, regardless of viability of baby and the health of mom. Whatever happens, happens, and it is considered God's will, what is meant to be. That being said, I have been doing some research into breastfeeding with the Amish community, and almost, I don't want to say every, but everyone that I have found, any type of paper, article, anything that is involving Amish women and breastfeeding also includes the words birth control, which I think is really interesting, that they are not allowing any kind of medical birth control, but they are allowing the concept of breastfeeding to control birth. This is kind of more of an older concept, that when you're breastfeeding, you are not able to conceive. It is possible to conceive while breastfeeding, but it is just less common. But this just made me think of other type of natural methods that might be interested, that might interest women in the Amish community, because while they aren't able to do most of the typical versions of birth control, things such as like calendar monitoring, checking on fertility, and body temperature are options that might be something that could be addressed, and that if with the education, it might be considered allowed. It's just something that I found, and have not seen anything that would say that this would not be allowed. So I just kind of wanted to also speak on one study that I have found. It is from Franklin Marshall College in 2004 to 2008. This was basically the only study that I was able to find that is actually with people going into the community and actually speaking with members of the Amish community that has been published, that from what I can find in all of Lancaster, which I think is very interesting, that there's just not been a lot of studying on this, which is the main reason that I wanted to be able to do this research and do this project. So what this study expected to find was just that Amish women will have higher rates of poor pregnancies outcomes, will have lower birth rates, will have more problems along the line. What the study actually did find, that was based off of in-person interviews with select members of the community who were willing to speak, was that actually Amish women are having better pregnancy outcomes than women in the general population. I think this is very interesting considering everything I have just told you about their working throughout their pregnancy, the lack of consistent healthcare, the allowing pregnancies to go beyond the due date, as well as all these just genetic disorders that play a role into pregnancy outcomes, that we're still finding that Amish women are still having better pregnancy outcomes than the general population, which just kind of brings into question of maybe the English community also has something to take from the Amish community as well. That while it is important to encourage them to be able to come to us, it is also important for us to acknowledge that they are doing it better than we are sometimes. And it is just a very interesting concept to just think about. And it is something that I'm going to continue to look into throughout the rest of my internship and the rest of my project. Okay, so I just wanted to include a working list of my references. As I said, there's not a lot of published stuff that I've been able to find, so I've been doing most of my research based on interviews. Okay. And then I just wanted to say thank you to Kim and to the museum for allowing me to have this opportunity. It has meant a lot to me, and it has been very fun, but also very educational. And I really appreciate everything that you guys have allowed me to do and all of your help, from all of Kim's help. So I'm just gonna go ahead and open it up to questions if we have any.
Thank you so much, Sam. If anybody has any questions, please feel free to put them in the chat. While we're waiting for some questions, Sam, if you're okay with it, Dr. Alan Peterson would like to briefly share some of his experience when he was a resident with pregnant Amish women.
Oh, yes, definitely.
Thank you very much. By the way, Samantha, I thought that was a very fine summary, especially for someone who has as yet not been that involved in medicine. So thank you for your time and research on that.
Thank you.
I wanted to share with you a bit about when I was a resident back in the 1700s. No, just kidding. 1970s. I was down in Quarryville as our clinic down there, and we were seeing quite a few Amish at that time, and there was developed a possibility of delivering some of these Amish women in their homes as residents. So we had already undertaken our OB training at the hospital, etc. And I had actually made several home visits on some of these pregnant women. They allowed us into their home. We tried to tell them what to expect and what to set up at home, since we wouldn't be able to carry all of the clinic instruments with us, but we would have what we thought would be necessary if there was an emergency and so forth. Again, we were getting ready to do this. I had made several visits to several patients, and then the obstetricians at the hospital heard about this, and the obstetricians told our department that if this was done, and if there were problems with the pregnancy, with the deliveries, that they would not be happy with taking care of them after the fact. And we should think about maybe transferring them to St. Joe's Hospital. I don't know if this was a legal thing at the time, but we were dumbfounded, obviously, and so were the patients. They were very unhappy and found care elsewhere. So that never came to pass. But if it had gone through, I think, Lancaster County would have different ways of caring for some of the pregnant Amish. I remember one Amish lady and her baby at the hospital when I was a first-year resident in OB. It was a very difficult delivery. She was in the hospital. It was a very difficult delivery. The child was born alive, but did not look good and was not breathing well, etc. We tried to resuscitate the child, and for a short period of time, we were successful, but the child died within a couple of hours. I remember holding back tears, trying to tell the mother what had happened. And she just said to me, "It's okay." She says, "It's God's will. And I will go forth and we will have another healthy child." So I just thought I'd share those with you.
Thank you so much, Alan. That was amazing. It's nice to hear from somebody who has dealt with the situations like Samantha was discussing. And maybe you two can work a little bit closer together and while Sam's continuing her research. I do have a couple questions here in the chat for Sam. So Doc and Judy Antonin and Brenda Neff would like to know if you know, what is the general age when the Plain women have their first child?
So typically they will start having children right after getting married, which will on average occur in their very early 20s. I have seen some that will happen in very late teens, but late teens, early 20s is generally going to be the first age.
Okay, and do you know if women continue to have children into their 40s as some English women do?
I do not know exactly. I would imagine that it's probably going to be vary just as it does with the English community. I have found that they will typically have 6 to 7, maybe 8, sometimes even higher children. And I assume that those will probably be like a year or two apart. So they'll definitely be having kids into their 30s. I just do not know exactly within the 40s, but I can look into that.
Okay. If there's any other questions, please feel free to put them in the chat. Otherwise, I would like to first and foremost thank Samantha. She did a fantastic job with her research and was nice enough to do this lunch and learn for us. It is not typically part of the internship requirements, but she was nice enough to do this for us to update us on what she's been doing with regards to her research. I also would like to thank and recognize WellSpan Health, specifically for sponsoring this internship. We have had this program for quite some time now, and I without the support of WellSpan and Lancaster General Hospital, we wouldn't be able to have interns like Samantha come and do research like she has done. The next Lunch and Learn will actually be on September 12th of 2022 by our Lancaster General Hospital 2022 summer internship winner, Megan Schulman. She will be discussing smallpox vaccine in Lancaster County. So if you're interested in that, please feel free to go to our website, lancastermedicalheritagemuseum.org/events. And register. I see that doesn't seem like there's any other questions. So I want to thank again everyone who donated to be here, Sam, WellSpan, and Alan for sharing his experiences. So I hope everyone has a wonderful rest of your day. And we will see you next time.
Thank you.
Thank you all.